Good afternoon. Welcome to our lecture course, anatomical course, and today we are going to start studying arthrosyndesmology. This is a division of human anatomy with information about joints. All joints in our body. We will study this section. How are you, my friend? How you hear me? Let me know. I see all of students put your name in chat box, and that is very good. I see only 10% in that moment, but as I know, there are 70 students in your course. Okay, that's good. So, well, let's get started. The topic today is arthrosyndesmology. Another word, another name, that is the bony joints. Maybe you know that human skeleton needs to move, but bones are too rigid to bend without being damaged. Fortunately, flexible connective tissue hold bones together at points of their contact, and those contact between joints Давайте я напишу Иванову в курсе, напишите, что это вам, хорошо? Владимир Павлович, все по плану, следующий понедельник, следующий вторник, да? Я постараюсь подъехать. Настроение бодрое, надеюсь, да? Хорошо, удачи вам, спасибо. Sorry, and this contact between joints we called joints, and they still are meeting. And in most cases, they make possible some degree of movement. Think for a moment about the amazing range of motion and the complexity of the coordinated movements that occur as the bones of the body move against one another. Many joints' actions are repeated daily and produce continuous work from childhood and throughout our adult lives. How does joints make this incredible staining power possible? Why do joints sometimes fail and cause our movements to become painful? How can we prolong the efficient function of our joints? We will find answer to this question in our lecture with that name termed as a arthrology or arthrosyndesmology. Here you see the woman, the girl, Russian gymnast, world champion. Her name is Yulia Guntel, and she is a woman snake because she does such as incredible movements and flexible of their trunks, and we will see how it will be possible in this lecture. Let's get started. Today question or items is 6 items. We will study most common principle of the joints, their classification, etc. And also we will study only trunk joints today. Next lecture we will study upper limbs joints and lower limbs joints and with the X-ray anatomy of these bones combinations. First of all, I'd like to tell you something about joint classification. As you see here, there are two main types of bone joints in anatomy. The first group is called synarthrosis. These are immovable joints in several. Next group number 2, group we called diarthrosis. And as you see, this is another name of diarthrosis is the synovial joints or discontinuous. It is a rare term in English anatomical education, but it is very popular here in Russia. Sometimes we call synarthrosis as inseverable joints, but diarthrosis as a discontinuous joints. Regarding synarthrosis, we distinguish 3 groups there. First group we call fibrous joints. That is the joints usually combined. They consist of the connective tissue. There are ligaments, interosseous membranes, sutures, comphoses, fontanelles, and shingles joints in this category. Membranes, again, ligaments, membranes, sutures, fontanelles, syndicales, and they consist of connective tissue only. The second group in synarthrosis is cartilaginous joints. The Greek name is synchondrosis. What is a common feature of these joints? Their joints consist of cartilagen. This is a special tissue. It is a little bit rigid, and they join together. We could find these joints between hip joints in the front of human pelvis. They are not very movable as a fibrous joints. And the third group is the bony unions. What does it mean? Bony unions. This is the joints. Actually, telling truth, that is not joints. It is just some combination of 2 bones. Between there we have not cartilaginous tissue and not fibrous tissue, but only ossa or bony tissue. It means that is absolutely immovable group of joints. Let's take more details about fibrosis joints, and we will start from ligaments here. Fibrous joints are joints in which the neighboring bones, as I said before, are joined together by a solid mass of dense, irregular connective tissue. The adjoining connective tissue can vary from small fibrous strands of connective tissue to large, thick bands to extensive membranous sheaths. There are three types of fibrosis joints: ligaments, interosseous membranes, and sutures. In ligament, like you see here, all of this structure are ligaments, here, here, and here. As you see, ligaments are located between two bones, and this is also ligaments. There are a lot of ligaments in our body, and in ligaments, the dense, irregular connective tissue is typically arranged as a bundle, and the joint permit limited movement. It is possible to move a little bit between two and the second joints where we find ligaments. The second group of fibrous, we mean this group of fibrous joints. This is the interosseous membranes. It is a substantial sheet of dense, irregular connective tissue that binds neighboring long bones and permits slight movement. Here you see os in our antebrachium called radius, and ulna here. Between them we find flat connective tissue structure that we call membrane. Like here is interosseous membrane, because between two bones. And membranes not only help hold adjacent long bones together, they also play an important role in defining the range of motion between the neighboring bones and provide an increased attachment surface for muscles. I mean that here it is not only connection, that is a place where muscles have their origin points. Next group of fibrous joints are sutures. A suture is a fibrous joint composed of a thin layer, dense, irregular connective tissue. Here it means that between two cranium bones we find a small layer of connective tissue. Telling true, we could find sutures only on the cranial bones. A lot of, mostly all cranial bones are connected with the sutures. We by their shape, we distinguish three types of sutures. Here, most popular suture between Calvarian bones called serrator sutures. Serrate sutures. Second sutures we call squamous sutures. This is connection between temporal bones here and parietal bones. And the third group of sutures, that is plain sutures. It is really plain, as a like two plate connected together. So a lot of small bones in the facial cranium. We find flat. We could find flat or plain sutures. Next group, another example of syndesmosis is called gomphosis. Or another name is dento-alveolar joint, because it is between dents. Here you see real human dents, and this is the part alveolar process of mandibular or maxilla. And this combination, gomphosis, gomphosis, is connected like a peg, fits into a socket. The only examples of gomphosis in human body, that is the articulation between the roots of the teeth and the socket. Another name of the alveolar fossa, we call the socket, and the dents contact this socket as a metal peg. Here's a peg, and it's the same idea, like hammering, when we take hammer and press to the peg fits and move it in the wooden. Next group of the fibrous joints we call fontanelles. Fontanelles look like membranes. They exist between the bones of the newborn skull and turn into the sutures after 2 years. There are 6 fontanelles on the skull, 2 pair and 2 unpair. We call 2 unpair like anterior fontanelles here and posterior fontanelle. but two pair. Number 3 is sphenoidal fontanelle, and near processus mastoidus we called mastoid fontanelle. Take in consideration that fontanelles exist till the third years of newborn life. So children after 2 years commonly don't have fontanelles at all, because they turn into the sutures. And the last fibrous joints we called spondylosis. This is also fibrous junction of bones in which the sharp edge of one bone enter between the split edges. Here, this is the one bones, like a sphenoidal rostrum. It enters between the another bone having split here. It is very special kind of fibrous joints, and we find this type of joints also in cranium bones. Another part of our body actually don't have spondylosis, don't have such type of fibrosis joints. Next group of synchondroses we call cartilaginous joints. In a cartilaginous joint, there are solid connective tissue that allows little or no movement at all. The articulating bones are tightly connected there either by hyaline cartilaginous or by fibrocartilaginous. What does it mean? Mostly type of cartilaginous joints have special type of tissue we call hyaline cartilage. That is rigid and less of fibrostructures, connective tissue, less part of this cartilaginous consists of fibroconnective tissues elements. But another type of cartilaginous called fibrocartilage, like here between the clavicula and the sternum, and it is full of strong and resist fibro elements. That is very good because that fixed they stopped any movement of these combined bones there. We distinguish three types of cartilaginous joints. There are synchondroses, symphysis, and epiphyseal cartilaginous. Synchondroses, all synchondroses may be temporary. They transform in the bones union later, or permanent. and we find such permanent cartilaginous joints between two bones in the basis of cranium. Symphysis. This is cartilaginous joints in which the ends of articulating bones are covered with the hyaline cartilage. It has a slit inside. As you see, this is a small space inside of cartilaginous joints. Give the possible and to call them symphysis. Here we could find symphysis between two vertebrae. Better it is visible the split in lumbar vertebra. But also we could find symphysis here. This is the pubic joints, pubic symphysis. That is the name of these cartilaginous joints. And sometimes we find a split coming from the up, from the down to the top of the symphysis, and the split is better visible in women pubic symphysis. Next and last group of cartilaginous joints we call epiphyseal cartilages. What does it mean? That is the layer of cartilaginous tissue what we could find in the children bones. Sometimes we find small layers of such cartilaginous joints item in young men and girls, and usually they transform in the typical osteum bones after 16 or sometimes after 19 years. And actually it serves as a line of development, line of the bones development. Because of this structure, the bones grow they become longer and longer. And the last group of the thin chondroses we call bony unions or synostoses. This is a Greek term. Usually we find these joints or unions between two vertebrae in sacrum region. This is the lowest part of vertebral column we call sacrum, and between sacrum's vertebra we find bony unions. No cartilages, no fibrous connective tissue, only osseous tissue between two joints. That is typical for bony unions. And we also find bony unions between two pelvis bones. Here you see three pelvis bones, and they connected at the acetabulum. This is a place for connecting with the hip, or femur, os femoris, and this is also bony unions between these three bones of pelvis. Next group is diatrosis group or synovial joints. The characteristic of a synovial joint that distinguish it from other type of joints is the presence of a space called a synovial cavity. As you see, this is a section of the finger, and this is the joints between two bones of the finger, and we find the cavity yellow. It is yellow here, and this cavity we call synovial cavity of joints. Synovial joints range from slightly movable to the most mobile joints of our body. There are three main components in every joint. Three elements here. First element is articular surfaces, and they are covered with the articular cartilage. Here, let me demonstrate. This is the one articular surfaces on and the one bones, and that is the second articular surface. And this is a blue layer. That is the articular cartilage. This is a cartilaginous tissue, and usually it is hyaline and very smooth surface. It helps to move, to take movement this articular cartilaginous, and then special fluid helps lubricated articular cartilaginous reduces friction between bones in the joint when they move, and this element, I mean articular surfaces, they help to absorb shock when we move our joints. Second element, main element of the joint, called articular capsula. It is made by a connective tissue and surrounds and attaches the articulating bones. The capsula is made up of two layers: a fibrosis membrane on the outside and synovial membrane inside. Take a look. Here is external layer of articular capsula called fibrosis membrane, here, this name, and inside of the joints, internal layer we called synovial membrane. So The articular capsula consists of two layers: fibrous membrane and synovial membrane. The third one element is synovial cavity. It consists synovial fluid. This is a real fluid that reduces friction. Here, yellow is a fluid and it is located in synovial cavity. So, let's repeat it again. Three elements. Articular cartilaginous, covering articulating bones. This is the first element. Articular capsula consists of two membrane, fibrous and synovial membrane. And the third element is synovial cavity with synovial fluid. Number 1, number 2, and number 3. Except of main elements, in addition to the main elements of the joints, there are auxiliary elements or subsidiary elements, in other words. Many synovial joints also contain accessory ligaments called extracapsular ligaments and intracapsular ligaments. Outside of joints, here the knee joints, and we nicely see the extracapsular. They covered joints outside, but we also could find the internal structure in the knee joints, and we call them intracapsular ligament because the firsts and the seconds are ligaments. By the way, these two ligaments inside of knee joints we called cruciate ligament because they cross each other like a crest, like a cruciate. We distinguish anterior cruciate ligament and here visible posterior cruciate ligaments of the knee joints. Second subsidiary element of joints called interarticular cartilages. Here, this joins between mandibular and temporal bone, and we see the big and curved articular disc inside of the joint. We call them articular disc, and sometimes this interarticular cartilage has the special hole in the centrum, in its centrum. Then we call such as not this is a circuit or concentric shape of the cartilage we call meniscus. That is cartilage divided usually, and discs and menisc partially divides the joints, and usually the menisci of joints are crescent-shaped discs that are prominent feature of the knee joints, as you see. By the way, knee joints has got a lot of subsidiary element, not only disc, not only menisc, also a lot of ligaments and plieces, etc. Maybe you may ask me about what function is for meniscs, and I think that menisc helps absorbing shocks between two bones. They also allow better fit between articulating bony surfaces. They also provide adaptable surfaces for combined movements, and meniscs distribute weight over greater contact surfaces as well, and they distribute synovial lubricant across the articular surfaces of the joint. So it is a polyfunction, but the problem is that sometimes we have injuries of the joints, of the knee joints, especially menisc. Here you see menisc in the knee joints, and sometimes we have a trauma and some injuries of that anatomical structure, and it needs, as you below, we see the injured meniscs, and it causes a problem for patient. So they need to be operated with a special equipment, and which allow to see knee joints space inside and operated without cut the skin. Very popular operation because a lot of athletes, sportsmen have problem with that small intra-articular cartilage. The third subsidiary element of the joints, called labrum. Labrum is that is a prominent in the balance socket joints of the shoulder and hip. Here you see hip joints, and this is peripheral cartilages, like a lip that extend from the edge of the joint socket. Is calling labrum. If we cut labrum and see the section, we see the triangular surface in transverse section, and it increases the area of contact between the socket and the ball-like surface of the head of the femur. So this is a special element help to that connected or articulating surfaces suit each other better. The fourth subsidiary element, it is also knee joints, called synovial bursa. Synovial bursa are located between the tendons of the muscles and the capsula of the joints. Here you see the tendon, and also this is the small bone in the knee joints we call patella, and between this structure and bones we see pouch or synovial bursa. That is the name. This fourth subsidiary element. The fifth element we call synovial sheath. Sheath is the better pronunciation. These synovial sheaths surround the tendons of the muscles, passing through the osteofibrosis canal. Between some places in the hand and foot, we find the tendons, that is a part of muscles connected to the bones, and they have special fixes, special ligaments that form inside canal, and where the tendons come through, and to reduce friction, that is the synovial sheath are for reducing friction. They reduce friction in such joints. The next is classification of joints by axis of motions and by their shape. That is the anatomical classification based on their biomechanical properties. According to the biomechanical classification, joints are subdivided into uniaxial group of joints, biaxial joints, and multi-axial joints. This classification depends on the number of rotation axes the joints have. As you remember, let me recall it, that we have three axes in the body: vertical, frontal, and sagittal. They have 90-degree angle between each of these axes: sagittal, vertical, and horizontal. Three-dimensional space and only three axes. So when the movement are around when we talking about when we are talking about uniaxial joints, they have only one rotation axis around which they can perform flexion and extension or abduction and adduction movements. Sometimes another movements we call rotation to the outside and inside. You see here pivot joint or trochoid joints. The rounded or pointed surface of one bone articulates with the ring formed partly by another bone and partly by a ligament. Here you see the ligament and the ring-formed surface of ulna. It is the scheme or diagram of such pivot joints, and the example of pivot joints is the radioulnar here. This is joints we call radioulnar joint, and that enable the palms to turn anteriorly and posteriorly as the head of the radius pivot around its long axis in the radial notch of the ulna. So it is difficult to explain me, but as you take something in your hand, for example, the cup of tea, and then turn it anteriorly, that means that you lose your tea because it comes down, and then you can back when you turn the hand posteriorly. So this is the turning movement is performed thinking by the pivot joints or radioarticular joints here. Also, uniaxial joints we find in hinge joints or ginglymus joints. Hinge joints is in elbow joints. We have only one axis here, frontal axis, and this type of joints typically permit only flexion and extension. Here is flexion and opposite movement we call extension. Example of hinge joints is also ankle joints and interphalangeal joints here between bones of the foot and hand fingers. Biaxial joints. They have two axes of rotation. You see one axis and the second axis. Or here one axis and second axis here, vertical and frontal. The examples of biaxial condylar joints they have such name because they have condylus. This is the processes of bones, and here also condylus, the processes of bones. So we call condylar joints. Usually they have two axes. One of them are vertical. Here is vertical, and here is also vertical axis. Usually it permits movement around two frontal and vertical axes and combine them. It is a flexio extensio in knee joints and in the temporomandibular joints. It is moving the mandibular up and down. So, but it is also possible to rotate the joints around the vertical axis. Next form of biaxial joints we call ellipsoid joints. We find that in radiocarpal joints. That is a convex oval-shaped projection of one bone fits into the oval-shaped depression of another bone. Here, this is the oval-shaped projection, but here is oval-shaped depression. And ellipsoid joint is biaxial because the movement it permits is around two axes. One is frontal axis. It permits flexio extensio, and another is sagittal axis that permits abduction and abduction. Plus, it permits to this axis permit to make circumduction. This is a special term when that is not isolated movement, but it is a combination of two movements. That is a partly flexion, extension, abduction, and abduction in the same time. The saddle joints or cellular joints. It is the articular surface of one bone is saddle-shaped, like here, saddle-shaped surface, and articular surfaces of other bones fits into the saddle as a sitting rider would sit. It is like cowboy seat, and it is very similar. The movements at the saddle joints are the same as those in the ellipsoid joints: biaxial flexion extension and adduction plus limited circumduction. An example of saddle joints is the carpometacarpal joint between the trapezium of the carpus and first metacarpal joints in the thumb bones. And the third group of joints, that is classification, it is biomechanic classification. is called multi-axial joints. The articulation surfaces of bones are plane, are flat, and they are combined in the planar joints or flat joints. Here you see joint between two tarsal joints, and it called intertarsal joint. Sometimes we find plane joint between ribs and sternum. Sometimes we could find a lot of plane joints in carpium, that is a part of our hand, as well as in the intervertebral joints between the head of ribs and tuberculous, or some that is the tuberculous on the rib and the surface on the processus transversus of the vertebra. This type of joints, I mean plane joints, allow to move in different direction, forward, back, right and left, and rotation, and combine. They try to have circumferation like here. So that is the maximum type of movements we could find in multi-axial joints. More amplitude of the movement we find in the second group of multi-axial joints, is called spheroidal joints. That is like a sphere. Here one bone has a ball-like surfaces, and another bone fitting into a cup-like depression of its processes. Such spheroidal joints are triaxial or multi-axial, permitting movements around three axes: flexion, extension, adduction, circumduction, and rotation. Examples of ball and socket joints are the shoulder and hip joints. Here the hip joints, and that is a typical spheroidal joint. In some textbook you may come across the term amphiarthrosis. What does it mean? Amphiarthrosis, or stiff joints whose mobility is greatly limited by strong ligaments. You see this type of joints between sacrum and one of the hip bones, and it is plain, but a lot of ligaments inside stop moving and fix the bone strongly together. So all elements of joints are present here, but no moving we do in that type of joint. So amphiarthrosis, that is joints what has no moving because of the subsidiary elements. Another classification of joints by number of articular surfaces. This is a classification by complexity. So we distinguish simple joints when we have only two articular surfaces inside, like for the shoulder joints, one surfaces and second surfaces, so only two surfaces. It means that type of joints we call simple. But if there are more than two articular surfaces, for example, in knee joints, 1, 2, and 3 surfaces, those joints we call compound joints. Another term is combined joints. What does it mean? Combined joints, it is that is a set of several joints in which movements are performed simultaneously. It means that, for example, here you see temporomandibular joints left and right. No movement in one of these joints is possible without moving in the other joints. They move together, but anatomically these joints are separated. This is the left part of head. This is the right part of head. But moving is combined, so we call this group combined joints. For example, for another example, we could demonstrate two joints between the first vertebra and the second vertebra. They have three joints: central or median atlantoaxial joints and two lateral atlantoaxial joints. The movement is around vertical axis, and we could rotate our head left and right, but all of these three joints move together. They have combined movement. So this is also the example of combined joints. And complex joints. Usually we call complex joint, it is a joint in where we find intra-articular cartilage. That structure divide the cavity of the joint into the two level. For example, this is the cavity, and inside we find intra-articular cartilage. This is cartilage. So we have one level and second level. Between these parts of cavity located disc or menisc. Here is the disc inside of it is inside of sternoclavicular joints, and this is the menisc, two meniscs in knee joints, such as two floor or two level joints we call complex joints. A couple of words about movement. Around frontal axis, that would be two kind of movements: flexion in Latin, and extension, flexion and extension in English, but flexor and extensor in Latin. Here is a flexion of the shoulder. Here is a flexion of the antebrachium, and this is a flexion of the hand. As well, this is a flexion in hip joints, flexion and extension in knee joints, and sometimes we call a lateral flexion in the vertebral column. That is also suitable for head. We call flexion forward and back flexion or extension of the head. Around the sagittal axis, we produce adduction, adductio in Latin, and abduction or abductio in Latin. This is the abduction when it go horizontally in shoulder joints. When we move it back to the trunk, it called adduction. This is abduction and adduction in the radiocarpal joints. Here you see abduction and adduction in the hip joints, as well as in the metacarpophalangeal joints. Abduction here, and adduction is next. Around the vertical axis, we call this movement rotation. Outward or lateral rotation, and inward or medial rotation. So when we do that way, we call lateral rotation or outward. And when we produce this way of movement, we call it inward or medial rotation. It is the same for the hip joints. Outside rotation we call lateral, and inside we call medial rotation. Around the sagittal and frontal axis, it's possible circumduction. That is the circumduction, when the end of the leg produces a circle. Here is visible also circumduction in the shoulder joints. In special movements occur only at certain synovial joints. Here, for the temporomandibular joint, elevation of the mandibula and depression of mandibula, protraction of mandibula and retraction of mandibula, inversion of the foot and inversion of the foot, dorsiflexion in the ankle joints and plantar flexion. And please note that rotation in the elbow joints in antebrachium we call supination and pronation. When we stand in anatomical position, we usually keep our arms in a supination position, and then when we move the thumb finger medially, we produce pronation. And take a look for the finger first and the maximum the first and the fifth finger in hand. They when they move each other and touch each other, this type of movements is called opposition. This is the factors affecting range of movement, and you see there are a lot of factors that affect range of motion in all synovial joints. First of all, it is the structure or shape of articulating bones, strength and tension, tightness of the joint ligament. It is also arrangement and tension of the muscles, etc. And this is a joint description plan just for us. You could use it during your practical lessons and to be oriented of the points you have to characterize to tell something about each about every joints in our body. And the last part of our lecture is divided to the bones, trunk bones joints, and we start from vertebral column. The vertebral column, also called as the spine or backbone or spinal column, makes up about 2/5 of the total height of the body, and it is composed of a series of bones called vertebra. Here you see all of vertebra named as 7 cervical vertebra, 12 thoracic vertebra, and 5 lumbar vertebra. That is part of free vertebra, and it is only 3 sections: cervical, thoracic, and lumbar. But there is also 2 segment of spinal column, which is consists of the unmovable vertebra. This is a sacrum from 5 vertebra. They join each other with the bony unions, and it is also coccyx. Usually it consists there are 3 coccygeal vertebra producing bony unions here. The coccyx and sacrum, they have some of symphysis between them here, but all of sacrum and coccygeal vertebra are not movable. It is not possible to move between them. Spinal column has several important anatomical structures binding the vertebra together. What kind of? This is between the body of the vertebra we find intervertebral discs. It has a nucleus pulposus inside. This is a small part. It is like a liquid, but strong part of the intervertebral disc we called annulus fibros, and that is consists of the connective tissue, fibra, fibers. And another joints of unfused vertebra is anterior longitudinal ligaments, anterior ligament. We also find posterior ligaments here. This is on the posterior surface of columna. So we have anterior and posterior ligaments. And also we could find the cartilaginous structure in some of intervertebral discs, and with the split inside. So then we call this intervertebral disc like a symphysis. Maybe you remember that. We also could find some of ligaments on the surface, posterior processes or spinal processes of the vertebral columns between transversal processes, and this is an important part of joints of unfused vertebra. This is called the Epiphyseal articulationes, or joints. Epiphyseal means in Latin between the processes on the arcus of vertebra. Some problem cause the nucleus pulposus when it come out and compress the nerve here, and we call that as herniated discs. That is a big problem because it is very painful for people. The spinal column of an adult is divided in 4 regions and presents 4 characteristic curvatures in the sagittal plane. These curves are the result of human adaptation to upright bipedal locomotion, acting as a spring to cushion axial loads. You see, that is our spinal column is not like a line. It is like a curve, and these curves we call the lordosis and kyphosis. So when we have this curve in cervical region, we call it cervical lordosis. Then we find another type of curve that is kyphosis, and we call it the thoracis kyphosis. And then again we find lumbar lordosis here, and also again the sacral kyphosis. So it means normal spinal column has 2 lordoses and 2 kyphoses. They help human to adapt for the bipedal locomotion, like we go when we use only our legs for moving. And the formation of all lordosis and kyphoses start from the newborn period of time. Only child have only one thorax lordosis. Then it became more curved, and this is developed of the cervical lordosis, and then when children start to stand, the curve it has usually four curving, or two lordosis and two kyphosis. This picture shows the signs of wrong posture. When people have incorrect posture, like here, that is a very curved thoracic kyphosis, and that is the normal position of the spinal columns. And this is also abnormalities or abnormal curves we call scoliosis, when the curves are in the frontal plane, not in sagittal but in frontal, and hyperkyphosis and hyperlordosis, like here. That is the abnormal curves. And the movement of spinal cord is also very big, because it is a combination in the intervertebral joints. They summarize somehow and allow us to move very freely, very free. A typical vertebra, the first and second vertebra, atlant or axis, another term, they combine special complex joints, atlanto-axial joints. As I said, this is the three joints: central or median and two lateral, and they are combined, and they move together and produce rotation only. Next joints are thorax joints. The thorax joints or thorax skeleton, thoracic cage or thorax, you see here, this is thorax cage or thorax, consists of the vertebral column, the 12 pairs of ribs, and the sternum. So 12 pairs of ribs, vertebral column, thoracic vertebra here, and in the centrum is the sternum. Combined together, these structures produce movably interconnected by ligament through joints and synchondrosis. This is the superior thoracic apertura here, and inferior thoracic apertura here. Rib joints. Anterior view with the right half of sternum sectioned frontally. You see true joints are generally found only at second to 5 ribs. The first, the 6th, 7th attached to the sternum by synchondrosis. Here is not joints, that is the synchondrosis. But 8th, 9th, and 10th ribs attached to the upper rib with synchondrosis portion. But the 11th and 12th ribs are floating ribs, and they have no attachment to the sternum. That is the costovertebral joints between processus transversus here and tuberculum of ribs, and that is a typical plain joint or flat joints. This type of joints are generally found only at ribs only at ribs from fifth to the tenth, because the this some of this is I mean 11th and 12th ribs have no such joints, but the another type of joints here, this is joints of head of ribs, and usually it has saddle shape joints, but only only first and 12th and 11th joints are like spheroidal joints. This is the chest shapes. It's depend on the human constitution, human somatotype. Usually we see hyperstenic constitution when the angle between ribs are large. Then conical shape of thorax with the normal or normosthenic constitution, and asthenic constitution has a sharp angle between and narrow type of the chest. And here you see pathological chest shapes. Usually we call it ricket thorax. Here this anteroposterior section is elongated, the sternum protrudes forward in a keeled manner, like a cheek chest, and the anterolateral surfaces are depressed inward and are connected to the sternum at an acute angle. And funnel chest, this is a pathological form or pathological type of the chest when the anterior wall of the chest is concave inside, like here. So we find here the depression, the anterior side of the chest. That is a different combination of splitting sternum or splitting chest splitting, which is also the abnormalities. This is all for now, my friend, and I hope you have some question. Please let me know what kind of question you are. Please type all of your question in the textbook, in the chat book here. So I am waiting your question. No, there are no questions today. Okay, then let me address you to our Moodle system, our education element in our university. We call it Moodle, and there you will find the test for today's lecture. And please, you have a lot of time just to pass this test, and I will show how you understand the today topic, the today lecture. Okay, this is all for now. Wish you very good wish you to be successful in the test and hope to see you next week on Monday in our anatomical lecture course. Thank you very much and bye-bye.